The National Network of Libraries of Medicine is an outreach and education program coordinated by the National Library of Medicine and carried out through a nationwide network of health sciences librarians and information centers. The mission of the NNLM is to advance the progress of medicine and improve the public health by providing all U.S. health professionals with equal access to biomedical information and improving the public's access to information to enable them to make an informed decision about their health. The NNLM All of Us National Program is a pilot project that will support the All of Us research program's community engagement and participants through the National Network of Libraries of Medicine. Through its 8 regional medical libraries, NNLM provides funding, training, and connection to empower members to transform their communities with trusted health information. The 3 overarching objectives of the NLM and All of Us partnership are: 1, to help public libraries in supporting the health information needs of their users; 2, to support community engagement through public libraries for the All of Us research program; and finally, to operate the All of Us Training and Education Center, the home for training and resources about and related to the program for the general public, health professionals, researchers, and participants. We will achieve the first 2 objectives through the NNLM All of Us Community Engagement Center, which is located in the Greater Midwest region at the University of Iowa in Iowa City, Iowa. The All of Us Training and Education Center is operated out of the Middle Atlantic region at the University of Pittsburgh in Pittsburgh, Pennsylvania, and will be focused on engaging program participants and other interested parties in management of their personal health data. One of the All of Us research program's engagement strategies is to attract and engage participants by collaborating with patient, community, faith, and civic group partners, which will allow the program to engage with a robust set of organizations that reach a variety of audiences, including potential participants and their families, hard-to-reach and minority populations, faith-based communities, and civic groups. To support this strategy, we hope to engage and connect network members with public libraries to develop effective, innovative, and replicable approaches to meet health information needs of communities. We want to ensure our activities will be responsive and tailored to provide value-added services for public libraries and public library staff, such as health information credentialing, resources and partnerships for programming, and funding opportunities. We are looking to enhance public libraries' existing health information programs as they align with our program. So the NNLM All of Us Community Engagement Center activities will be rolled out in 3 prongs. First, we are focusing on public library staff training in consumer health information, as well as other capacity building activities. To do this, we have placed an emphasis on promoting the consumer health information specialization through the Medical Library Association to public librarians, and by developing and updating several consumer health courses. We are also collaborating with the Medical Library Association to host a symposium on health information for public librarians in conjunction with MLA this year, and we are also in the midst of wrapping up an NNLM national partnership with the Public Library Association and are developing plans for a phase 2. Our next approach includes major investments in targeted geographic areas to supplement and enhance public library programming and activities related to health information. The All of Us research program has identified 12 geographic areas in which we have begun reaching out to public libraries and will continue to identify additional communities throughout the rest of the pilot. And you can see on this list, on the slide here, are the 12 communities that we have started reaching out to. And finally, we are focused on providing a general awareness of the NNLM All of Us National Program and are developing opportunities for other public libraries not in targeted areas to participate and engage their patrons. Ultimately, our goal is to reach all populations with trusted health information, but especially populations that are underrepresented in biomedical research. In addition to establishing the Community Engagement Center in the Greater Midwest region, each of the regional medical libraries have received funding to hire additional staff to coordinate all of us community engagement activities within their region, and these people will be your point of contacts as you partner and engage with the program. You can find their contact information on your region's point of contact by going to the NNLM website and selecting your region, or by going to the NNLM Community Engagement Center website. All right, so next we are going to hear from Amanda Wilson. Amanda Wilson is the head of the National Network Coordinating Office, which coordinates the National Network of Libraries of Medicine. Prior to that, Amanda served as the director of the National Transportation Library, where she focused on building collections, data curation, increasing awareness of the NTL collection and services, and coordinating the National Network of Transportation Libraries. And let me just bring up her slides very quickly. All right, Amanda, feel free to take it away.
Thank you, Brittany. Good afternoon, everyone. As Brittany said, my name is Amanda Wilson. I am the head of the National Network Coordinating Office, or NNCO, here at the National Library of Medicine. And the role of my office is to coordinate the NNLM. With regard to NLM's partnership with the All of Us research program, the NNCO serves as the PI for NLM, specifically working with the All of Us research program's community engagement component. Today, I'm going to briefly overview the NIH All of Us research program for you. Next slide, please. Let's start first by hearing from Eric Dishman, the All of Us program director and Leiter lecturer for this spring, about the need for the All of Us research program. So Britt, it looks like I'm not hearing any sound. Is it possible for you to play it directly on the machine by copying and pasting the URL?
You know what, I wonder.
You got everybody.
Well, I wonder if I was, muted. Let me try again.
Okay. He looks very engaged. I'm excited to hear, but still no audio.
Still no audio? Okay. Give me just a moment. I'll bring this up.
I tested it last night and it worked with me. So. Still loading.
Okay, well, technology is defeating us today. I will just promise you guys this is a wonderful 3.5-minute video posted actually last Thursday, where Eric Dishman discusses the need for the All of Us research program from 3 perspectives: that of participants, healthcare providers, and researchers. So what I was planning to do for the rest of my time today was to unpack a little bit of what he says. So can I ask you guys afterward to take a look at the link? It's really good. It's very brief, but it just gives you the perspective from the NIH and the program director's side from the value of the program. So it's a great talk. The script is also there if you just want to quickly read the transcript. But we'll just move ahead to the next slide, and I'll talk a little bit more about the All of Us research program, and then I think we'll have a few minutes to answer any questions. So next slide, please. So hopefully you'll have a chance to go back and hear some of the context of why the All of Us research program and why from the we feel it's important to spend federal taxpayer dollars on this program. I'm going to go over some details about implementation and unpack a little bit what you'll hear Eric saying once you listen to the presentation. So precision medicine is a new approach to improving health, treating disease, and finding cures. It acknowledges that each person is unique, our habits, our environment, and our biology, and that the interaction of these factors greatly impacts our health. These unique variables also mean that medical treatment that works for one person might not work for another. So precision medicine aims to deliver the right treatment for the right person at the right time and keep people healthy longer. The All of Us research program is a cornerstone of the Precision Medicine Initiative, or PMI. PMI aims to enable a new era of medicine through research, technology, and policies that empower patients, researchers, and providers to work together toward the development of individualized care. Next slide, please. The All of Us research program itself is a historic effort to gather data from 1 million or more people living in the United States to accelerate research and improve health. The program aims to reflect the diversity of America through its participants. All people living in the United States, not just citizens, are able to participate. The goal of All of Us is to help researchers understand why people get sick or stay healthy. With information from this program and from this 1 million or more person cohort, researchers might discover better tests to see if people are sick or at risk of getting sick, better mobile apps to encourage healthy habits, and better medicine or information about how much of a medicine is right for each person. Next slide, please. Participation in the All of Us research program will be open to interested individuals living in the United States. Again, citizenship is not a requirement. If someone decides to join All of Us, they will be asked to share different kinds of information. The program will ask for basic information such as name, address, and questions about the person's health, family, home, and work. It will also ask for access to electronic health records. It may ask for blood or urine samples. To protect people's privacy, the program will take multiple steps to protect privacy, including taking federal information security measures and de-identifying data. If someone withdraws from the program, she or he will have the options of 1, keeping his or her data and samples available, or 2, having the All of Us program destroy the samples and data. It is not possible to recall any data or samples that have already been used in a research study. Next slide, please. The All of Us research program's engagement strategy aims to attract and engage participants in 3 ways. The first way is through healthcare provider organizations, or HPOs. All of Us is partnering with HPOs across the country, and each HPO has an outreach and engagement plan specific to their community. In this recruitment strategy, participants are recruited through doctors' offices and clinics. The second and third methods of engagement focus on the direct volunteer method on the left side of the screen for recruiting participants. Direct volunteers can go to joinallofus.org, call the All of Us program, or use the app to join. There is an All of Us Participant Center team that is responsible for attracting direct volunteers to the program. They work nationwide. They have a broad strategy with many, many partners who you can find listed on the All of Us website. All of Us also uses partnerships with patient, community, faith, civic, and engagement partners to supplement and support direct volunteer activities. These groups are responsible for direct engagement with a robust set of organizations that reach potential participants and their families, hard to reach and minority populations, faith-based communities, and other civic groups. The partnership that NNLM has with the All of Us research program and the effort of pairing the network with public libraries falls under this last approach. Next slide, please. One of the ways the All of Us research program is meeting its goal of reflecting the diversity of America is by targeting that 50% of that 1 million or more cohort is from populations that are traditionally underrepresented in biomedical research, or UBRs. So that's saying that 500,000 out of the 1 million people All of Us hopes to recruit is from a population that is traditionally underrepresented in biomedical research. As of January 2018, All of Us defines these UBR populations based on the 11 criteria you see before you on the slide. Through our partnerships in the network with public libraries, NNLM wants to reach all populations, but especially UBR groups. Next slide, please. So as you've heard from Britt earlier, the objective of the NLM partnership with All of Us is to connect the power and resources of the network to the public library community, as well as operate the All of Us Training and Education Center, which is the education home for the All of Us research program. So next slide, please. That is a really brief overview of the All of Us research program, its recruitment strategies, how it's aiming to reflect the diversity of those living in the United States, and also a bit how we in the NNLM connect with that program. We'd like to take a moment now to stop and answer any immediate questions you have about the All of Us research program. We may or may not have the answer, but we'll take them down and distribute them if we don't.
So Amanda, there haven't been any questions in the chat box, but Liz did some troubleshooting on her computer with the video and she has it up and we can share it real quick. So if you want to stop sharing, Liz can start and we'll try one more time while we wait for some questions.
Okay, do I need to do anything to stop sharing?
Yeah, so at the top of the screen, there's a little, like if you hover over the top, there's a little stop share button. It's in red. Or is it me? Oh no, it's me.
Okay.
Sorry. There you go.
All right, a second here. I'm going to go ahead and share this.
Thanks so much, Liz.
Yep, you're welcome. All right, so here we go. And if someone could just let me know if they hear this.
So I will get friends and other people emailing to me saying, why are you doing this All of Us research program? Why are you spending taxpayer dollars to go do this program? What's it about? And I think those are great questions. And I kind of answer it in three ways, kind of from a patient perspective, a provider perspective, and a researcher perspective. And if we start just with what all of us experience as patients, the vast majority of us do not have access to precision medicine-based cures because this field is in its infancy. Great progress in some places like cancer, but the vast majority of conditions don't have a path to figure out what can I possibly take as this individual who's unique. And that means we're all still treated as the average of the people who happen to have been studied with your particular condition. And we're kind of in this one-size-fits-all medicine. And that means, especially if you have a complex illness, a lot of trial and error, right? Side effects from this drug. No, that didn't work. Let's try this one. Let's try this one. And everything in the care system is well-intentioned. But man, suffering through that expensive and painful trial and error is not a great way to live as a country. Now let's think about the providers, right? Not a great way to live for them either. They've got more and more pressure to see more patients per day. Half the time they don't even have the complete medical history of that patient that's right in front of them saying, please help me. And then they don't have that much science and evidence behind a lot of the conditions that they're expert in to be able to know exactly how do I deliver care to right here and right now to this patient. And on top of that, they've then got the challenge of, at the same time, there's huge amounts of new scientific discovery that are coming in literally every day. They'd have to sit around reading all the time and never lay hands on a patient to keep up with the latest scientific literature. And then the third piece of this is the researchers. We have observed biomedical researchers at the cutting edge of precision medicine, sometimes getting 3, 4, 5-year grants and awards, but they'll spend 40 to sometimes 70 or 80% of that time on building up the IT infrastructure, the computing and the data, and how do I secure the data? And they'll spend even more time trying to recruit people to participate in that study. 85% of clinical trials have to stop early because they can't recruit enough people to be part of that. So that's an enormous cost and drain. And as soon as you get your award done, you get a little bit of science on that award, and all of a sudden you got to start over with the next one. Start again. Here we go. We got to build up the cohort. We got to build the technology. We got to build the research protocol. This public resource of the All of Us research program says, get to the research faster. We're going to hand you one of the largest cohorts in the world that will be the most diverse. You don't have to go recruit anybody. We're going to hand you a bunch of data that's already been cleaned and curated and made it easy for the researchers to use that. And we're going to hand you the computing and technology and infrastructure that you don't have to spend your time on. Get to the science faster. And if those researchers get to the science faster, then those providers will have more options to offer to that patient standing in front of them saying, help me, cure me. And we as patients will have more options, less trial and error, and more specificity to get it right the first time when we walk in saying, help me, cure me.
Thank you, Liz, for making that work. This is Amanda again. I did see one chat question. Just wondering if and how the uninsured and underinsured will share the same benefits of precision medicine as those well-insured as Medicare, Medicaid, which have been cut a lot in my state. So in terms of looking at the people, whether or not they're insured or not insured, as you just heard Eric say, and we talked about, they want to get everyone. And if you go back and look at the cross-section of UBR populations, a lot of those folks, as well as anyone who might sign up, would be insured, would have different insurance status. So the All of Us Research Program is not healthcare. So in terms of benefiting from precision medicine, everyone would benefit in the same way, in that we hope that there would be a broad, diverse cohort who would enable researchers and healthcare providers to develop those individualized and personalized treatments. But the All of Us Research Program is not a healthcare program, so everyone would need to find healthcare somewhere else. So in terms of the insured and underinsured, that's a little bit out of the scope of all of us.
Amanda, we have another question. For how long are participants followed once they enroll in the program?
Sure. So the All of Us Research Program is a 10-year program. That's a great question. So it's intended to go for a decade. And I think I said a little bit earlier, so participants have the opportunity to withdraw at any time. We hope that they would stay engaged over the 10 years of the All of Us Research Program, and part of our engagement with public libraries here in the network will be hopefully helping to support engagement.
Thank you. Next question. Are you sure the 12 sites are the only ones? I have an active group here in San Diego.
So the 12 sites that Britt mentioned earlier were the sites that NIH has given NNLM to work with. So I talked about the two approaches to enrolling: the direct volunteer approach and the healthcare provider organization approach. San Diego is one of those areas with a healthcare provider organization working, and they have the geographic area of San Diego and others. So I think there are 18, there might be more. So you see active things working, that's in the healthcare provider area. NLM and our partnership was in the direct volunteer area. So we are intentionally in places that aren't covered by healthcare provider organizations or HPOs. So those 12 reflect where NIH is putting heavy investment of communities.
All right, next question. Are they oversampling the underrepresented groups?
So anyone can sign up. So I don't know the specific answer to that question, but I do know that anyone can sign up to join, and you will be asked information about your lifestyle and your environment. Not everyone will be invited to come in and provide physical measurements and blood and urine samples. Those who will be invited to come and take that next step and provide their physical measurements and blood and urine samples, that will be where the 50% from underrepresented populations is managed in that way.
Hi, and this is Linda. The health provider organizations were given or proposed statistics on how many people from different underrepresented groups or population groups that they would be recruiting to try and keep that balance.
All right, just a follow up of the uninsured question. There was just another question about how making sure that people who are uninsured are able to access the benefits from the implementation of the results. Is that correct? Am I interpreting that right?
I don't know where which question.
Right here. So just wondering about the implementation of the results in terms of how the uninsured or underinsured will share the same benefits of precision medicine.
So anyone, am I on?
Yeah.
Anyone that participates in the program will get information back to them as the individual, regardless of their health insurance. So you'll have this big repository of data that researchers can work with, and then the individual also gets some information. It's on a participant portal.
Okay. And then how are the privacy concerns of patients addressed?
So in a couple of different ways, data is de-identified. The program has received, federal FISMA security requirement. The Data and Research Center is housed at Vanderbilt, and there are several biobanks that are storing this physical specimens, and that's all connected by code versus individual personally identified information. So in terms of the All of Us research program is following the federal information security and management principles, as well as the privacy principles established by the PMI, the Precision Medicine Initiative, and then data is de-identified before it goes to the DRC. And then in terms of access to the Data and Research Center, the DRC, anyone can request access to the data. There are different levels of access. You would have to identify yourself and be verified, as well as take annual training in order to have access to the data.
All right, next question. What strategies are planned to overcome reluctance of some groups to participate due to distrust of the government, fear of sharing their data and biological materials, etc.?
So that are some of the things that the community engagements, the Chief Community Engagement Officer, Dara Richardson-Heron, is addressing head on. So in terms of strategies, having open dialogue and conversation, her interpretation of our engagement, which includes what NNLM is doing with public libraries, is building a relationship, as this is a 10-year program, relationships with communities. So in many ways, she's brought on many representatives and representative organizations from these populations who frankly have plenty of reason to be distrustful. And so bringing all of those people to the table as part of partnership and doing outreach to many of those communities through organizations that represent those communities. So those are some of the ways. I encourage you to go to the All of Us website, joinallofus.org, and take a look at some of their community partners and some of the FAQs there about engagement strategies.
And this is Linda again. As an example, I was on a Hispanic association recently, and there was, discussion about the All of Us program and getting involved because hypertension is a particular concern of Latino community, and so they said, they're not going to be able to help us if we don't participate in this program. So that's an example of one association's outreach to its community to encourage them to participate.
All right, next question. How will or are the NNLM sites and healthcare provider sites coordinating and collaborating? Is there a list of the healthcare provider sites? So there is a list of the healthcare provider sites on the All of Us research program website that you can take a look at. Because the pilot is so new that we haven't done a lot of direct coordinating with the healthcare provider sites, but we hope that that happens here in year 2 and 3 of the project.
Look under funding to find the sites.
All right. Next question. Has any planning execution of this project changed in light of the Golden State Killer case and use of genetic databases to catch him? A good question.
I am not in a position to know that answer. We'll take that down.
That's too fast for the government.
We will find out. All right, hold on. The descriptions of how the participants' health data will be used is a bit vague. When considering the application to participate, is a potential participant provided with a more detailed description of the studies or types of studies that the data will be used for?
So it is in general, when you sign up, there is informed consent, and then the model that the All of Us research program is implementing is progressive consent. So essentially, anytime someone wants to do something with participants' data or something is asked, for example, they want to start doing genotype analysis in early 2019, participants will have to opt in and reconsent for that specific activity. So the All of Us program is not counting on an initial consent and then everyone agrees and they do whatever they want in 10 years. Every time something is done with participant data, participants are asked to contribute to the discussion, and 2, they're asked to reconsent.
All right, I think we're through all of the questions. So if no more pop up in the next couple of seconds, we will move on to our next presenter, Rachel Timms. Rachel is the All of Us Community Engagement Coordinator for the South Central Regional Medical Library. Rachel holds a Master of Science in Addiction Studies from the University of Arkansas at Pine Bluff. Prior to joining the NNLM, Rachel served as a Prevention Project Officer for the Mid-South School of Social Work at the University of Arkansas Little Rock. And Rachel, while I am getting your slides up, feel free to unmute yourself and start talking.
Thank you, Brittany.
You're welcome.
Okay, good afternoon, everyone. My name is Rachel Timms. Like Brittany said, I'm the All of Us Community Engagement Coordinator for the South Central Region. Our regional medical library is located at the University of North Texas Health Science Center in Fort Worth, Texas. Next slide, please. The South Central Region is one of 8 regional medical libraries in the U.S. We work with the state of Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. I want to remind you that the All of Us program may be executed differently in other regions. We would like to take a look at what the All of Us program looks like in the South Central region. If you see anything of interest, please contact your regional point of contact. If you don't know who that is, please feel free to email me. My email will be at the end of the presentation. And so today we're just going to look at what it looks like in the South Central region, and we're very excited that we're one of the first regions with program sites assigned by the National Library of Medicine. Next slide, please. So just an overview of what we are going to discuss. We're going to discuss the 2 phases of the All of Us program in the South Central region. We're going to go over our assigned program sites, the health educator position, as well as the contractual process. And last but not least, we will give you an update on opportunities available for non-targeted public libraries in the South Central region who would like to participate in the All of Us program or want general health information or resources. Next slide, please. So our primary focus with the All of Us program is to train library staff on quality health information and resources, supplement existing programs in the library that are health related, start new health programs based on the community needs, and establish and strengthen community partnerships with the public library and community organizations. We believe the best way to accomplish this is by embedding a health educator in the public library. Next slide, please. So the All of Us program has many layers, as you know, and the South Central region is a part of the community engagement component of the program. We do not recruit participants. Instead, the NIH and NNLM teamed up to raise awareness about the program by partnering with public libraries. The three main objectives of our partnership include helping public libraries in supporting the health information needs of their users, supporting community engagement through public libraries for the All of Us, and providing training and resources about and related to the program for consumers, health professionals, librarians, and researchers. The South Central region is currently working with 2 program sites, which include Albuquerque Public Library and New Orleans Public Library. So you may be wondering, what exactly are we working on with our program sites? Next slide, please. So like I mentioned before, we are working with our program sites to embed a health educator at their library. The embedded health educator will be hired by the public library to exclusively provide All of Us program support, extend the educational offerings of the All of Us program, promote the All of Us program, provide health information and service training for the library staff, and offer health information education to the public library community. So our goal is to have the health educator make authoritative health information and health education accessible to the public, provide education in locating, understanding, and accessing quality health information, increase understanding and engagement in the All of Us research program, provide education on personal health information, which will enable individuals to make informed decisions concerning their health care, as well as offer in-service education to library staff to increase knowledge and skills in providing health information to the community. So for network members in the South Central region, if you are near a program site, please feel free, once that health educator is hired, to discuss ways to collaborate with them. You know, we want our health educators to build relationships with other community organizations, as well as build awareness of quality health information, resources, and the All of Us program. So this sounds great, right? But exactly what does this mean? Next slide, please. So these are just a few examples of health programming that can be implemented in the public library with the embedded health educator. Our health educator will conduct the needs assessment at the library branches in their area. The needs assessment will assist the health educator with planning health programming activities. And one good thing about it is that we have a budget for our health educator to solicit expert speakers in the field, because we want our health educator to have like 3 or 4 core courses to lead people to quality health information and resource, but we also want to touch bases on those topics that are important to the community as well. Next slide, please. So our contractual process has 3 phases. This program is from May 1st to April 30th, 2020. So our first phase is on the admin level, which consists of a program overview of the All of Us program, scope of work discussions, and commitment to participate. Our second phase is also on the admin level, and this is when we negotiate the contract, identify signature authority, as well as finalize those contractual items. And during this process, we're also talking about reporting and evaluation needs, as well as discussing hiring mechanisms. And we have found that phase 1 and phase 2 normally takes about 2 to 3 months to accomplish. The third phase is on the operational level, which includes program launch, the onboarding of the health educator. And this is when you'll start seeing health programming start, as well as in-service training and partnering with community organization, as well as there will be a reporting and evaluation system in place. Next slide, please. So we know that community members might come to your library requesting health information and want to be able to, we want you to be able to offer more tools and resources to those to them. So the South Central region is currently working on a phase 2 of the All of Us program, which is called the South Central Toolkit. Our goal for the toolkit is to provide public libraries not in our targeted areas with quality health information, resources, network membership, funding opportunities, as well as training, in-service training, general health information, and free educational materials and print files. So most of these items are available now, but our toolkit isn't finalized just yet, but it should be coming up soon in June. And if you would like a copy of our toolkit, please email me with SCR Toolkit as the subject, and I'll add you to a list to make sure that you get that. Next slide, please. One of the things that I'm very excited about is the All of Us launch party. I will actually be at the launch party in Birmingham, Alabama. I know Linda and Darlene will be discussing this topic more in depth, but I just want to let y'all know that I'll be in Alabama. And if you are in that area, please come by my booth and stop and come talk to me and my colleague, Kelly Ham. Next slide, please. Again, I want to thank you for your time. Please remember that we are one of the first regions with program sites, and we are still shaping this program. Like I said before, please feel free to contact me, and thank you.
Thank you very much, Rachel. We're going to move on to our next speakers. We've got Linda Walton and Darlene Caskey. Linda is the Associate University Librarian at the University of Iowa and is the Director of the Greater Midwest Regional Medical Library. For several years, she was the Associate Director of Regional Offices for the National Network of Libraries of Medicine. Linda received her BA and MLS from Indiana University. And Darlene is the All of Us Community Engagement Coordinator for the Greater Midwest Regional Medical Library. Darlene received her MLS from Indiana University, Bloomington. Prior to joining us, she worked for the GMR as a Technology and Communications Librarian. All right, so while I bring up your slides, feel free to take it away.
Okay, I think I'm first.
This guy, right?
So good afternoon, everyone. So the All of Us research program has been in beta test for about 2 years now. I think they've recruited over 20,000 people, somewhere between 20 and 23,000 at this point. They spent a lot of the time on the beta testing, developing the consent information and privacy information. I think you all had questions about both of those, so they're taking those very seriously. So now, after 2 years, they're ready to go live so that anyone in the country can sign up to be a participant in the All of Us research program. So to celebrate this launch, to celebrate this event, they've scheduled a launch for May 6th. Next slide. So the launch will be physically celebrated in 7 areas across the country. Pasco, Washington.
Sorry about that.
Pasco, Washington, Chicago, Illinois, Detroit, Michigan, New York City, Kansas City, Missouri, well, Kansas City, Missouri, Kansas City, Kansas, Nashville, Tennessee, and Birmingham, Alabama. Let's see. So each one of the partners that Amanda referred to earlier, the community outreach partners, were invited to self-identify to host a live celebration. And that's why the sites are where they are across the country. And we were asked to host a site. The NNLM was in the center of the country, so we identified Kansas City as our site. And we'll have a health fair, speaker presentations on both a national and a local level, and some other fun activities. And you're going to hear more about that from Darlene after I'm finished talking. So next slide. You can also, if you can't attend a live event, the launch event presentations will be a live broadcast on Facebook. And this slide provides the link to the online site, and you can find it also on the NNLM webpage. One of the scrolling screens that goes by has this information on it. If you want to write it down, it's launch.joinallofus.org. And it will begin at 3 p.m. Central. So at that point, you'll hear the primary speakers from the All of Us Research Program, Francis Collins, Eric Dishman, and Dara Richardson-Heron. And then you'll be able to move around to the 7 sites to hear various local speakers talk, depending on your interest. So I am going to stop at that point and have Darlene tell you exactly what we're doing in Kansas City.
Thanks, Linda. So the National Library of Medicine and us, National Networks of Library of Medicine, and Delta Research and Educational Foundation, we're very happy to host this family-friendly, fun community health fair event in Kansas City. It's going to take place from noon to 5 p.m. at Union Station, which is this historical building located in downtown Kansas City, Missouri. It's accessible via public transportation, and the day of, parking will be free to encourage people to come. Next slide. So we are surrounding the NIH All of Us launch from 3 to 4 p.m. with an afternoon full of family fun and literacy. We have Asia James. She is the daughter of Kansas City Mayor Sly James, and she's both a fitness instructor as well as a children's author. So she and the mayor will be reading her children's book, and then she will also lead a fitness workout. We have Healthy Hip Hop. It's a rap group with positive health messages to get kids moving. They're locally very popular. And we're having the Steppers of KC. They can teach us the famous Kansas City two-step. Also in the Grand Hall of Union Station, families can create a community art piece with Vania Soto. She's this local Kansas City artist, and her art was influenced by her native Mexican homeland. Also, we have Science City. They're located in Union Station, and they're a Smithsonian affiliate. They're going to demonstrate experiments for both young and old, as well as give out discounted admission coupons. And then speaking of giveaways, we have colorful health and science books for toddlers as well as younger and older readers, and we're going to have prize drawings for Fitbits. That's the wearable device selected by the All of Us Research Program to provide motivation for health and fitness. Next slide. So overall, we have approximately 30 community clinics and nonprofits, as well as health systems and public and medical libraries donating their time to share health information. Now, throughout the event, we also have these little 10-minute MiniMed talks. They'll be discussing risks for obesity and diabetes, or the importance of talking with your family about inherited diseases, or how to find quality health information, searching Medline Plus and Genetics Home Reference. The National Association of Hispanic Health Nurses will be offering blood pressure checks, and the Good Samaritan Project will be screening for hepatitis C. And then all of the vendors will share consumer health and wellness information about resources in and around Kansas City. Next. Finally, and not to be overlooked, are our local speakers. At the end of the national presentation, which will be from 3 to 3:30, we will have local Kansas City speakers. We are very grateful to the Children's Mercy Hospital for Dr. Tom Curran, who will be speaking, as well as Kelly Rinaldo. She had a daughter who was diagnosed with Turner syndrome, and she started a alliance, and she will be talking about why she is an advocate of precision medicine. And of course, and I don't want to leave this out, Carolyn Lewis, Delta Research and Educational Foundation President, is speaking, as well as our own Dr. Brennan. She will be telecast. So, next slide. That's how we're doing it. That's the end. That's how we're doing it. Health, literacy, and fun in Kansas City.
You tell them about our giveaways, our books, and
All right, so we're back to me as soon as I find there we go. All right, so just a reminder too, if you guys have any questions about any of this stuff, please feel free to keep adding them to the group chat, and we will address them at the end. We're making it, we're getting there, so hang in tight. So I'm going to talk to you a little bit about how to get involved in the All of Us National launch. So the All of Us research program has provided us with several resources that are available for us and our members to use to promote the launch. And we put several of them on our community engagement website. To get to the website, you can go to nnlm.gov/all-of-us. And I'll throw this in the chat box after I'm done speaking. And then from there, you can navigate to the All of Us launch materials page under the resources tab at the top. So all of the assets on our website are available for you to download and use to promote the event, and several of the assets are available in English and Spanish. And I have provided for you on this slide some examples of the resources that you can download. So on the left, we have a button template. If you have access to a button maker, this can be a very easy item to create and hand out at your institution or organization. In the middle of the slide are some examples of some digital flyers. These are available for you to put on your website or post on your social media pages like Facebook or Instagram, and there's a variety of different sizes, and some will allow you to put them up during the event, and then if you hyperlink to the launch website, people can click through and watch some of the simulcast presentations live. The poster on the right side of the slide can be downloaded and printed and posted on community bulletin boards, break rooms, etc. And there are several varieties of these posters and the other items on our website. So you can help promote the launch by providing information about the All of Us research program and the launch. You can motivate potential advocates, bring allies together, and increase general awareness of the program in your community. And so I encourage you to think about potential partners who would be willing to collaborate on promoting the event with you, or other places that might allow you to put up some promotional materials, including local libraries, community centers. You can bring it up and provide resources at regularly scheduled meetings between now and then, local clubs or organizations, religious organizations, local coffee shops, restaurants, and other businesses in your community. We also encourage you to live stream the event and show other program videos. We have embedded several videos of the resources, several videos on the resources page that have been created by the All of Us research program, in addition to a link to the All of Us research program's YouTube channel with additional videos, and this is something that you can share widely as well. And then finally, if you're in one of the 7 launch locations, please encourage anyone and everyone you know to head out and enjoy the festivities. It should be lots of fun. All right, next we're moving back to Amanda to talk about other ways to get involved. As soon as I find the slide.
Thanks very much, Britt. While we're pulling those slides up, really we want to move into an opportunity for you guys to share some of your thoughts and ideas about how you think you can best contribute to the effort and our partnership. You just heard about our launch events, and thanks so much for the GMR team and all of our POCs and the rest of the RML staff for pulling together to contribute to each and every one of those. And secondly, we're going to be having listening sessions and Q&A discussions at the NLM booth at MLA in Atlanta in a couple of weeks. These are the scheduled times where Brittany, myself, and Fran Yarger, the program lead for the Training and Education Center, will be at the booth, and we hope to have some conversation and elicit some ideas and thoughts about how to best incorporate health sciences libraries and our NNLM members with public libraries in the accomplishment of these goals. And then thirdly, I'd like for us to talk a little bit more. So some other ideas, you might have seen some that Rachel provided in terms of the activities that are happening in New Orleans and in Albuquerque, but some other things that have come up. Public library staff have asked about a speakers bureau where public library staff can go and find local speakers on health topics in their areas to come and speak at events at public libraries. I don't think we've talked about it today, but the All of Us research program has a huge bus called the All of Us Journey that travels all around the country and makes stops. There's opportunities for us as NNLM to volunteer when the journey makes a stop in our area and have the libraries have a presence there. You can always partner with the local public library in your area and apply for existing funding opportunities from your RMLs. We're looking at, Brittany talked earlier about increasing the capacity for public libraries and really enhancing their health programming and other activities. One of those could be participating in a community of practice for consumer health information. We're hoping to launch something like that in the coming months. Also, you can participate by exhibiting at local health cares or other activities and bringing all of us materials like what Brittany just showed, or even partnering with your local public library to do the same. So these are just some ideas that we have, and if you go to the next slide, I would love if we could take a few moments and maybe brainstorm about other ways that, based on what you've learned, what you've heard, what you've thought about previously, how we can fully engage you guys and get the entire network involved in this partnership. So thank you very much.
All of you that are attending MLA to go to the at least parts of the Public Librarian Symposium that's being hosted at MLA. Some of you should have received already invitations to the breakfast, but feel free to sit in on different programs, go to the dinner, sit with folks from your community, get to know them. That's the next big thing I think coming up, where you have an opportunity to meet with some public library colleagues.
And we do have one question in the chat box. Do you know if ALA National Conference in New Orleans this June will have any All of Us related events? Would be a great stop for the bus, which is a great idea. I'm not sure if the bus is going to be there. However, the some of the point of contacts will be available at the Learners Roundtable session, where they will talk about some professional development opportunities for librarians to participate in. So you can see us there too. And I think we have several people attending. And also, if you guys have ideas, feel free. You don't have to put them in the chat box since this is a discussion. Feel free to unmute yourselves and have at it.
One thing that I would suggest that health sciences librarians could do, it's not part of the All of Us partnership in terms of public libraries, but it's part of our mission in terms of health sciences professionals, is to get up to speed on precision medicine and maybe offer, conferences, workshops, presentations, whatever, to health professionals, because it's such a new initiative. They didn't learn that when they were in school about precision medicine. And so when we've gone to meetings to hear more about precision medicine, that's always, the hands go up immediately from the health professionals asking how they're going to learn more about precision medicine. So keep that in mind when you think about your programming for the next year or two. Does anyone have examples of things that they've done with public libraries already that they could share with us to give us some ideas? I would say that's something we've done too, is encourage people when they do a program to put it on the Programming Librarians site that's hosted by the American Library Association, so that other people can get ideas about programming. There's health and wellness is one of the subject areas that you can put your projects in under.
So we have another good question from Jacqueline. If we were to start somewhere, where would you suggest? A website, a poster, new blurb, and a newsletter? I think that you're talking about in terms of like promoting and participating, and I think just getting the word out is a really great place to start. And you can definitely take a look at the resources on our website. and promoting the launch, I think is a great place to start. If you're looking for ideas for, programming, definitely also take a look at our website to get some good ideas about what you could do for programming. Have some conversations with your point of contacts or outreach librarians in your region. They have really great ideas and good knowledge about what has worked well in the past. And like Linda mentioned, the programming librarian website is a really great place to get some good ideas. And then hopefully soon in the next month or two, we'll be rolling out an option on our website to allow people to sign up for, opt in for additional updates and things like that. Oh, great idea coming from the chat box. Since the launch is Sunday, they're going to put a notice on Nextdoor, a localized social media site, to let people know about the event. That's a really great idea.
Oh, thanks. The number of people attending these local launch programs is variable from, I think they're expecting 500 at some places up to 1,000, 2,000 at other places. So it's exciting.
And we're going to have point of contacts at each location. So if you are in the area and are planning on going, please stop by and say hi to us at our NNLM booths. Is it appropriate to share the Facebook page from our own pages? I don't see why not.
Definitely.
Yeah, feel free to do that. Definitely. Good question. We'll give it a couple more minutes for additional comments or questions.
Are you going to have materials that people can contact their POC to receive when they do, if they were to do a promotional event? Like the card stock for All of Us, NNLM, All of Us National Program, that kind of stuff?
Yeah, we'll have additional materials made available on our website about the NNLM All of Us National Program. We can make that available by the end of the day for you to download also. And then if you're looking for something specifically, we may have it or we can develop it. Just feel free to contact your point of contacts and talk to them about what you need, and they can help navigate you through what we've got. Another idea coming out of the chat box is a PowerPoint with some talking points that you could use about the program and the launch, and that's definitely something that we can make available. All right, and one last comment. So I would assume hospitals that engage in community benefit activities would want to tie their speakers bureau to this important research program. Is anyone reaching out to that group of hospitals? That's a really great idea and something that we can definitely put on our itinerary for the next month or two. All right, you guys, I think everyone wants to get out and enjoy the nice weather, hopefully. We're experiencing some in the Midwest, and hopefully you guys are all experiencing good weather wherever you're at. So thank you for joining us to learn about the NNLM All of Us National Program and the All of Us Research Program, and we hope that you are inspired to get involved.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.